Hi, Dawn. I'm really excited to talk a little bit with you about what your work is about. Can you start by telling me what postpartum depression is?
Sure, Grace. Thanks for the opportunity to talk about this today. Postpartum depression is depression that women experience after they've had their babies. It looks a lot like any other depression in terms of symptoms. So sometimes women feel like they are quite teary. They've lost their joy and their zest for life. They feel sometimes just a sense of sadness or hopelessness. Sometimes they feel angry and irritable. Many women don't expect to feel that way. It can start as early as a month after women have their baby, and it's really different. It's different from the blues because the blues are kind of that teariness, feeling like women want to cry in the first few days after birth. But that goes away. And postpartum depression symptoms, they last. Usually 2 weeks or more, we start to get concerned about it.
So, Dawn, I know your work focuses on prenatal and emotional health. Can you tell me why you chose to focus on prenatal anxiety and depression and what that is?
Sure, Grace. Most new parents have heard about postpartum depression. The media talks about it all the time. But what we're discovering is that actually only caring for women or in the postpartum period in terms of emotional health, we're only looking for symptoms of struggle in the postpartum period is too little, too late. We now know that 50 to 80% of women that have depression or anxiety in pregnancy continue to have symptoms after they've had their baby. And in some cases, up to 1 in 2 women continue to have symptoms when their child is 5 and 6 years old. In other words, what begins in pregnancy tends to continue through the postpartum period and often for years after when women don't get help. That means our focus then needs to be not on postpartum depression, but on anxiety or depression that begins in pregnancy.
Okay, that's good to know. Now, can you tell me a little bit about what sort of emotional health challenges some women may face in pregnancy?
For sure. We find that as many as 1 in 4 women struggle with anxiety or depression. More women tend to experience anxiety than depression. Anxiety in pregnancy looks like worry, unrelentless worry, worry that continues and doesn't stop, worry over small things, not just big things in life, but over small things as well. It looks like when women can't stop their train of thoughts, so they just keep getting more and more anxious or worried about things that normally would not bother them. Sometimes it gets to the point where women experience panic attacks. They might wake up in the night with a sense of fear and dread, like they're going to die, might even affect them. Their heart is pounding, they're breathless. So it can also look like that. And depression in pregnancy looks very much the same as postpartum, only it's earlier. So again, sadness, lack of joy, lack of hope, loss of zest in life, either wanting to sleep too little or too much. Sometimes weight changes, beyond the normal scope of pregnancy. But a lot of times women just feel very, very low. And again, can be really part of this can be irritability and depression and anger. And women don't expect that. They don't expect that irritability and anger might mean that they're struggling with some depression. I think the other thing that's important is it's not only sort of the most severe symptoms that really matter. We're really talking about protecting baby's health. We're also thinking about even very mild symptoms, sometimes even anxiety or depression or high stress that is actually a bit under the surface. Women feel it sometimes, or they feel it enough that it's dragging them down, but not really impacting their lives in terms of their ability to go to work and still care for other children. But that kind of low lying anxiety and depression can still have an impact on baby's health. And therefore, we really want to help women to be as emotionally healthy in pregnancy as possible.
Okay, wow. So it does sound like there's a lot of symptoms that show up prenatally in pregnancy before
Mhm.
women have their child. So I was just wondering if you can tell me where pregnant women and those who care for them can find out more information so they're better educated on how to recognize the signs.
We are planning on populating our website with that kind of information, Grace. I would encourage pregnant women and women who have had their babies to go to our website for information that is clear, evidence based, it's got a science base behind it, it's accurate information, and it helps women how to know to take the next steps as well. That's a priority for us, not just talking about symptoms, but how can women help themselves and how can they know when they need help from others as well?
Great. Well, thank you for answering my questions today, and I look forward to asking you more about your work and how your work is positioned to serve pregnant women in our next call.
It's been my great pleasure, Grace. Thank you very much.
All right. Bye for now.
Bye now.